and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, you wanted to talk about some ACL rehab exercises. These aren't the ones that you do right away.
Right.
These are maybe what, after 4 weeks or so?
Typically around 4 weeks. And to clarify, it's ACL reconstruction. You had an accident.
Anterior Cruciate Ligament.
There you go. It's the ligament in the knee. It's kind of in the middle of the knee, so to speak.
In the joint itself.
Right. Often happens with girl basketball players, very common with them. They've actually done studies on it to try and figure out why so many females.
I think a lot of it's due to the shape of the bones on females.
Right. Football players, a lot of athletes, skiers have it. But anyways, if you had the surgery to correct it, and you got a graft either from a cadaver, it could be from your hamstring.
Right.
They use it from the infrapatellar tendon. You'll know if you have it. You know where it came from.
They'll tell you which one, what they used.
But the first thing you're going to do after surgery, you'll be casted up, and the first couple weeks is nothing more than gaining range of motion. You're going to have a brace on, not a cast, but a leg length brace. Then it goes to a hinge brace. Each doctor has their own protocol. But this is after that point. You've already got to the point you've been working with a therapist more than likely, you should be, in my opinion, but you got reasonably good full range of motion.
Yeah, full extension.
Right.
Big thing, right?
Yep, exactly. As well, flexion. I like to get my people back where they're pretty darn close to full extension. They can do this before
full flexion.
Flexion. Did I say extension?
Yeah. The opposite one.
Yeah. It gets cold out there. Things are still not working in my brain.
Okay.
So you got that range of motion. Now it's time to start strengthening. But you're not going to get too aggressive. You're not going to start jogging. You're not going to do any high impact, no bouncing or anything like that. You need to go through this appropriately so that you strengthen it properly, not have a setback.
So you're going to start off with warm-up exercises,
Yeah,
Brad?
warm-up. And actually, what I like to do for a warm-up is have the person go on a stationary bike, a cross trainer, something you're sitting on, and you're working the legs like a new step cross trainer, if you're familiar with that. You could go on a treadmill and do some walking. I really like the stationary bike for this because it's
good warm-up.
Yeah, very controllable.
Elliptical would work too, right?
Yeah, you bet. Yep. Not too aggressive. 5 or 10 minutes, get the heart rate going a little bit. Things are warmed up. Then we're going to go with the ACL, Bob. As you know, the hamstrings.
Very crucial.
Right.
Yeah.
Because what they do, they actually reinforce what the ACL does. The ACL keeps the tibia from going forward.
Translating forward.
Right.
In our technical terms.
There you go. And the hamstrings support that motion.
So you're really wanting to focus on keeping those as strong like bull.
Right, exactly.
Hamstrings.
Now, the interesting thing is, Bob, is you can go to a clinic that has fancy equipment all over the place, and chances are the therapist is going to have you do the same things that I'm showing here with simple,
very low-tech equipment.
Right. But if the exercises are done properly, this is going to give you excellent results.
Sure.
Stool scoots. Get on a stool with some good wheels on a good floor, and you pull yourself forward. This is all hamstring.
Digging in with the heels.
Yep. And I'll have a person go, this woman I've been working with lately, she went 20 feet. It took her 57 seconds to do that because I timed her. Within a week, she was able to do it in under 20 seconds. Much easier, and now she's scooting back and forth real well. And once you get that down, this should be completely pain-free. Just work on the hamstrings. Then we need to work the opposite muscle group, Bob, quadriceps.
All right.
Just take a TheraBand, put it around the leg
Or
a table.
stretch band. Some people, TheraBand is actually
right,
a brand name.
Yeah, we don't want to get that confused. And I just got a knot tied in it. The red tape, by the way, on Bob and I represents...
Yeah, that's the involved leg.
Right, the one that had the surgery. Now here, you want to get full extension. And this is not easy. This looks like it's really easy to do on a healthy knee, but after surgery, it's really hard to get these quads to be strong enough to get from here to here. Yeah, it's a little movement, but it's really important.
Sure.
And then to put weight on it at the same time so that you get start that proprioception or that balance along with it. And you'll do 10 of these and then rest. Put the weight on the other leg, do another set of 10, and the goal is 3 sets of 10. Typically,
back to the school students real quick. How long do you usually do those?
I'll usually go about 10 to 15 feet, turn around and come back, and it'll do 3 of those.
3 of those, okay.
It can be longer.
Sure.
It really depends on the condition of the person.
Sure. I'm sorry to interrupt, but I know, like you said, people are going to ask.
Yeah,
and now
exactly.
they're going to ask on this one.
Exactly, right, because we always get that question. How many sets, how many reps,
Right.
how many times a week? So that's that. Now, these two complement each other. Once these two become too easy, then it's time to progress to the next aspect of
So
strengthening.
is that going to be daily then? Are these daily?
Yes, it can be daily, but if you come up to a day where you're,
Really sore?
if you're sore, your knee is sore,
Yeah,
it's
you got to listen to
swelling.
your body,
Yep.
and that's always the case.
Yep. I mean, I've had people take a couple days off if there's swelling involved and things are sore. It's too early, it's too much too soon.
All right, why don't I go to work, Brad? Why don't you put me doing something
Okay, good. The next one we're going to do is,
here? Step-ups or
yeah,
squat?
we'll go to step-ups.
Okay.
The order of these is not that particularly important at this point. What is important is that you do not overdo it. Too much too soon. So now this is going to be,
The involved leg.
right, quadriceps strengthening. You're going to get some balance involved here. It's nice to use something to hold for balance. And just do a step up. Now this is a pretty tall stool. I would probably start with a 4-inch one, but you know, depending on the person.
I'm
you're just
coming
gonna
down to my heel, right, Brad?
Yep.
I'm
We're going to do a
keeping my toe.
profile on this. Or
Okay.
Show incorrect mechanics with the knee.
Like coming
Yeah,
in.
if the knee comes in. Here, let's get a nice visual here, Bob. Okay,
Okay.
go ahead, step up.
These are not easy, by the way.
No.
I'm going to go right first. I'm trying to do it correct.
There. Now, see how this, now you see how the knee bypasses that sagittal plane and gets out? No good. That is not
Out
gonna,
this way wouldn't be good either, though, right?
No,
Right.
no. Usually people
Are going to go in.
yeah, it's
right.
kind of a natural tendency. That's why I mentioned that.
My leg
Could
is
you cheat
fatiguing.
with your hips once, Bob, and do a hip hike?
Like
Yeah,
this.
and now go down and
Oh,
tuck.
like this.
Yeah, so you can. That's what the cane is for, Bob.
I know.
Now, I'm just as tall as I can get it. Bob's so tall he can't reach down with the cane.
But yeah, so you want to
wish-
keep your hips kind of level.
Here, hold this, Bob. That'll help.
There we go.
There we go.
There we go.
I'm not used to working with someone 6.5 foot tall. Another 6. They probably got your head cut off in there. You're
So,
doing a nice job
yeah,
with
I'm
that,
cheating.
Bob. Yeah.
Cheating.
There, you can see the hips
Oh,
are.
legs fatiguing.
Yeah. We got just one more point.
I'll do it this way.
Nope, the other way. There. Now, I want you to do it with the whole foot. Push off with your toe, but get this out of the way. Bring this up here. There you go. There. So if you push off with your toe, like he's doing,
You're cheating.
you can start that way, but once you get strong enough,
Then you want to go heel.
yes, that's a big difference, isn't it, Bob?
Yep. Oh yeah. And with this, are you trying not to put the knee past the foot, or not?
Yeah, you're trying to.
It's
but
tough.
It's not quite as critical because you're not flexing the knee like a squat.
Right. You're not doing a full squat.
Yeah.
So.
And again with this, you're not going to do 3 sets of 10 right away.
Yeah.
You're lucky. I started at a couple sets of 5 and then build up. And again,
I thought I was in pretty decent shape.
it's burning.
I'm
isn't it?
burning, yeah. All right, we're doing lunges next, Brad.
Yep, lunges.
You want to do those, or you want me to do those?
No, you do them, Bob.
Okay.
And again, a cane or a stick or something for balance.
So are you doing both sides, or are you just doing the one side?
No, you have to do both sides, actually. Come out and actually, you can do it this way. I kind of prefer bring out one leg and squat down and then back up and then down. So you're going to do
some repetitions.
Yep, 10 like that.
So you can do some some shallow ones to start off with.
Exactly.
Probably, and then to go deeper.
Yep, and then face them once, Bob, so they can see.
Again, I'm keeping the knee straight.
Yep. If you're using a balance aid, a cane or a stick like this, use it opposite the front knee.
Yep.
Because when he switches legs, go ahead and switch legs once, Bob.
Oh, you keep it in the side?
No, now you're going to,
Yeah,
I
now
think it's a
got
little
it.
easier to
Yeah.
balance.
Yep, it is absolutely easier
Yeah.
to balance.
Now, you can keep doing this, Bob. Bob's doing a good job of mechanics here. This one will probably put more stress on the ACL. It's going to pull
Sure.
that anterior tib forward and stress it. So if this is uncomfortable, you need to back off of it and do not get aggressive so that it stresses that new graft.
Sure, gotcha.
3 sets of 10 is what you're looking for. Chances are you're going to start with 1 set of 5, maybe a couple sets of 5. Work on the mechanics
And again,
first.
starting shallow probably.
Yeah.
So
Again, this whole process, these exercises we're doing here, you can do them once a day if tolerated, but these progress over a period of 8 weeks.
okay.
So you start out maybe 1 set of 5 or 10, and over a couple weeks you get up to 1 or 2 sets of 10. By the time you're on 6 or 7 week, then you're doing 3 sets of 10, and you're pushing it. You're getting antsy at that point.
Yeah, one last exercise, right, Brad? The one leg ball toss.
Right, exactly. Ooh,
Here's the ball.
There it is. Now balance, big one. So here's my involved leg. If you can stand on one leg for 30 seconds, you're ready for this. Go ahead.
This is a weighted ball.
Yeah, I don't know how many pounds this is.
6 pounds. It weighs a lot.
It's got a 6 on it, but I don't know
Yeah.
if that's what it means. But it's like a shot put.
It could be a 9.
A light shot put. And now Bob's a therapist. Now, Bob, why don't you start walking over there? There you go. And just keep throwing the ball back and forth like that. And then I can face this way and do a sideways, which gets it a lot harder. But you're really working that proprioception. And my ankle and my whole body is getting kind of sore.
You can see that's a healthy knee.
Yeah.
Dealing with that. So
This is something really fun for therapists to work with. I advise you to work with a therapist on this. This is kind of advanced, but it gives you an idea what you can work on or review. There's a lot of therapists that have been giving us comments. Maybe,
yeah,
they can
provide some more.
right.
So.
And so one way or another, it's fun, and good
All
luck
right,
with that
thanks for
knee.
watching.